Welcome to Invest Insights. I'm Abby Malone. I'm joined today by Vince Carrodeguas, the President and CEO of Banyan Health Systems of South Florida. He joins us for Season 2, where we dive into resilience in face of a pandemic. Vincent, before we start, tell us a bit more about Banyan Health Systems.
So Banyan Health Systems is a fully integrated community healthcare system. So there's two key words to our title, integrated. What does that mean? Well, we're not just a primary care regular medical clinic, but we're integrated with behavioral health services. That's part of our legacy. It's very important to us. We provide mental health as well as substance abuse rehab services. And it's a 50-year legacy that we're very proud of. We've been not just in the community for 50 years in both Dade and Broward County, but as well, we are part of the safety net of the behavioral health system of Miami-Dade County. We run one of 6 CSUs, Central Stabilization Units. Those are Baker Act facilities, and we are proud to be not just the largest, but with the most activity and the most sought after. So most of the police departments and the emergency teams all bring their clients to us because of our reputation.
To what do you credit the overall success of your organization's handling of the pandemic and the related challenges that it presented?
So that's a great question, Abby. And I would tell you that, there's nothing like a good pandemic to really test your mettle. I believe that the pandemic really brought to life a lot of things, right? Your home now becomes more than just your home. Your job becomes much more than just your job, right? Now it takes on a whole different meaning. And the reason for that is that there's so much uncertainty, and there was some chaos, right? There was some panic, rightfully so, as there should be. And that comes all with that uncertainty, right? But what it brings out for us, what it brought out for us is an incredible sense of teamwork, right? And so if you had people's attention before, boy, you really, really had it now during the pandemic, right? And so during that time, we had leaders emerge, which is for us fantastic. We reassessed our strategy. For the company, we have a 7-year, and I know it's a 7-year strategic plan. I know many companies do 3 years. Some companies do 5 years. Ours is 7 years for very specific reasons. We're in year 3 of that 7 years, and we had to pivot a portion of that plan. Although in retrospect, the pivot that we did was really all about infrastructure, but it's really not about that long-term strategy that we have. That's still intact. But the pandemic did have a great impact on that strategy from a infrastructure standpoint. And lastly, I would say innovation. So I'm big on innovation. Whenever there's a problem, innovate is the way to go. You think outside the box. Don't go those routine solutions that you normally have. Innovate is really a way to get ahead and really be able to expand and really progress towards solving whatever that problem is or whatever that hurdle is.
Telehealth has been at the forefront of the discussion over the past number of months, and its incredible potential has truly come to be realized more recently. From your perspective, what has been revealed to you about the potential for telehealth, and what has this experience taught you about the perceived ceiling for telehealth?
So again, that's just a great question. So let me go back. We recently published a white paper, and I'm sorry, my memory should work a lot better than it is right this moment. But I believe in 2012, there was a study on telehealth conducted by George Washington University. And so they had thousands of patients. This study went on for about 4 years. And the purpose of the study is at the end of the 4 years, how many patients or how many patient clients can you have sustained on a telehealth-based network, right? So there were thousands of clients. I don't know, I can't recall the details, but at the end of the study, just about 21% of those patients, of those thousands of patients in that 4-year study, was able to sustain their treatment through telehealth. Well, the COVID-19 really changed that, because we went from one day being 100% behavioral health and primary care services face-to-face to virtually 100% telehealth, right? And that really brought on so many challenges, right? It's not just telehealth, right? But on the primary care side, how do you connect with that patient, and how do you get to them? How do you take their blood pressure? How do you take their weight? How do you take their A1C1 rating, et cetera, et cetera? All those hurdles that we've been addressing over the last few months that I think we've been very successful at, we've been able to overcome little by little. And so the pandemic has really taught us that it is so extreme. That George Washington University study of 21% just went out the window. Now, there's one more element to this, is that although we have a large number of our patients today on telehealth, there's still a component of patients that we are unable to reach. So, you know, we're very fortunate. We have our iPhones, we have our MacBooks, we have our iPads, but frankly, there are people out there that don't have any of that. There are people out there that don't have the ability or the cognitive ability to conduct a telehealth appointment. They don't. And those folks are hard to reach, but they are as important or more important to reach. Because if you don't reach them, sooner or later, you know, they may crash, they may end up in an ER, they may end up in a Baker Act facility. And that's why we're here. We're here to really avoid that, right? And take care and manage their care beforehand. So that really brought up a huge hurdle for us. Now, we'll tell you on the primary care side, we're about 45%, these are estimates, on telehealth. The balance is face-to-face. On the behavioral health side, for mental health, we're in the high 60s, and the remainder is face-to-face. But that is evolving, right? Telehealth is not a decision that you make. The decision for telehealth is made by the patient. It's not made by the provider. They're the ones that are going to tell you, does it work or does it not work? Those are the indicators. And although a lot of people sprung into telehealth and said, okay, now we're going to conduct business via telehealth, well, it's just not that easy, right? You've got in the long run, and certainly it's long enough now, right? We've been on telehealth for about 5 months. We have enough indicators to know that there's just a group, a portion of our population that telehealth does not work. And we've got to get to them in a different manner.
You know, you bring up mental health. I wanted to ask, do you feel that there has been enough emphasis placed on mental health throughout the duration of this pandemic?
So another great question. Abby, I'll tell you, I am disappointed in the lack of attention, right? But not just the lack of attention. The attention, we lack so much attention over mental health that in society today, it's still a stigma. So yes, we have patient clients that come to us that tell us, I can't put it through my insurance. I don't want my insurance carrier or the potential for my employer to find out that I'm seeking behavioral health services. So they're not only paying for therapy and counseling out of pocket with insurance, but they're paying for medication. And so the answer is a flat out hard no. It is not enough. We got a long way to go. And just recently, we're trying to open up a couple of clinics, right? And so we're in expansion mode. We're very blessed to have a lot of momentum, and we're expanding our operation. And we have 2 independent cities that have questioned us in terms of opening up clinics in their cities, although we're opening up regular primary care locations. So what does that mean? We're trying to open up a regular women and children's primary care center. We'll have an OBGYN there. We'll have a pediatric doctor there. We'll have a regular family practitioner there. We'll have a dentist there. And yes, we'll have a behavioral health practitioner there in the event that integrated services are needed. Well, that behavioral health raised questions in 2 cities in South Florida. Wait a minute, Vince. We got to see what the zoning laws say. Well, never ask a question that you don't know the answer to. I already knew that answer. There was nothing in the zoning that prohibited us from rendering medical services, including behavioral health. But notwithstanding that, Abby, we're still getting a lot of pushback from those cities, believe it or not. So it is definitely a hard no. It is insufficient in the attention, and the stigma is still there, unfortunately.
It is said that crisis breeds opportunity. So I would be curious to know what kind of opportunities or innovations you see stemming from this pandemic, being a benefit to primary and behavioral health services at Banyan Health Systems operations in a post-COVID landscape.
So this is what happened to us. I mentioned a little bit, there's nothing like a good pandemic to bring people together, and that absolutely brought our team together. And here at Banyan, our team is relatively new because we have shifted. We have a series of executives that are retiring, that are slowing down, and now we have basically a whole new team, right from the chief financial officer to the CEO, including the COO, right? And so with that said, we brought that team together. That team started really evolving and addressing what those huge issues were. And so we saw opportunities in the marketplace to apply for grants, very extraordinary grants, I would call them. And so you're familiar with the Federal Communications Commission, the FCC. So what would the FCC be doing funding a healthcare system like us? Well, they went out to the marketplace, they put out a grant nationwide, and they awarded 11 recipients funding to develop telehealth. We were one of those 11. That was the first opportunity how the team came together. The team stayed together all through Easter weekend to get our proposal out ahead of schedule. We issued it, and within a week we were awarded it. So that's one big step for us. The second step is now we got this money, boy, now what are we going to do with it? Well, we already had plans on how we were going to innovate. That innovation really had to center around those patients that are hard to reach. So we've developed a new unit called our ITU, our Intensive Technology Telehealth Unit. That unit, what it does is, it is comprised of doctors, ARMPs, and medical assistants. And what they do is they monitor our patients 24 hours a day. We have that grant is slotted to reach 2,000 patients that are difficult to reach. Those patients will receive a suite of equipment, very small, very compact, along with a tablet. And that will be able to take blood pressure, weight, heart rate. It'll be able to take their blood sugar and report it back 24 hours a day as we monitor that patient while they're at home. They'll have a tablet in which they can communicate with a nurse or a medical assistant or even a doctor, and we'll be able to take care of those patients that were really hard to reach. We will deploy case managers in the field to help them use that equipment and then have it at the at their home for the time that it's needed. If it's 3 months, 6 months, a year, whatever is needed to service and help that patient. So that for us was probably the biggest deliverable and one of our biggest success stories.
I've been asking everyone in season 2 about resilience. In season 1, when the pandemic first started, most of the interviewees that I spoke with had envisioned a world getting back to normal by this time, and we're taping in September of 2020. And here we are, work is still not back to normal, social interactions are still not back to normal, we can't gather in large groups, and the light at the end of the tunnel is there, but I think a little bit hard for many people to see. So I wanted to ask you, what have the last number of months taught you about resilience?
Well, in order to be resilient, you have to be flexible. You just have to be flexible. And for us, you have to believe what's happening. There's a lot of folks that, are still thinking we'll get back to normal. And you know what? I hope we'll get back to some level of normalcy. But for us, we're going to have to accept the circumstances as they are today. And we will pivot for those changes. So we've been around 50 years. That's not by accident, right? That is by design. And we'll be around for another 50 years because we've been able to innovate. And frankly, we've been able to really increase that communication to all our employees, all 350, soon to be hopefully 450 as we expand our operations, and really continue to embed in all of them that ability to pivot and innovate as the circumstances change. So for us, we're now looking at 3 different locations that we will move eventually. We will have now a certain part of our workforce that will permanently work from home. Our offices, from the majority, will be hoteling space for not all of our employees, but for the majority of our employees. And yes, the appropriate amount of folks will have cubicles, the appropriate amount of folks will have that private office setting for whatever is needed. And our clinics will continue to operate as they're operating. They're just adding on the ITU unit, right? The primary care clinics, as well as regular telehealth services. So we're going to let our patients and clients tell us what they want. And we're going to have the ability to pivot and keep them as our patients and clients in the long term.
Well, thank you again. That was Vincent Carrodeguas, the President and CEO of Banyan Health Systems. You've been watching Invest Insights. My name is Abby Malone. Thank you for tuning in.
Hey everyone, don't forget to like this video and subscribe to our channel so that you can stay up to date on the latest business trends from our knowledgeable experts. Be sure to check out the description below for more information on the segment you just watched. Thanks for tuning in.